changes as we age. Hormones change throughout the lifespan as well. For younger women, when they start to develop their adolescence and they start to have their period, oftentimes the week before they get their period, their sleep goes off the rails for some women. They start to have insomnia and they don't know what to do about it. So there are treatments that we can do, and also talking to a gynecologist can be really beneficial to see what might be helpful for hormones, and also just things to do when it's laying in bed. Worries might be starting up more during that time, and knowing what's normal and what isn't. Using the sleep diary in the book can be really helpful to track any patterns that might be going on, because sometimes people just get so caught up in their sleep and insomnia that they aren't able to see that every 3, 4, 5 weeks the same thing tends to happen. So I do recommend using those techniques, and then maybe talking to a gynecologist and using the book as a guide as well. Then pregnancy is a really big time when women struggle with poor sleep. First trimester, hormones are all over the place. Women are having to urinate a lot in the middle of the night. Heartburn's a big problem. Sleep disruption is just part of being pregnant, and there's a part of it that you just have to accept, but there are things that you don't have to accept. So being uncomfortable, people don't often think about using pillows to their advantage, going to sleep maybe a little bit later, trying to nap when you can but not napping all day long, and really being mindful about what you're doing in bed, not just lying there all the time and not sleeping. So pregnancy, as you get in your 3rd trimester, you have to pee a lot, but you also are uncomfortable. Those are things that naturally happen, but what are the things that you can change? And the book will go through that a bit as well. Then when we hit perimenopause, estrogen levels drop, and women tend to report more troubles with awakening throughout the night and early morning awakenings. And the book will really discuss the basic treatment options when it comes to not laying in bed, tossing and turning, ways to kind of address those worry thoughts, because women in that age range often report that their minds are just racing. They wake up in the middle of the night and they can't turn their brains off, as well as how to limit the time in bed. That's a really important one that women often don't think about. Spending too much time in bed can actually worsen a lot of those problems. And then I have a chapter by one of my lovely colleagues who's an integrative medicine doctor, Dr. Takayasu, who goes through integrative medicine practices and some common medications that you might want to use, as well as when it might be time to talk to your gynecologist about any sort of hormone replacement treatments that might be appropriate.